So as we see the conduction system again, as we place these limb leads on, we have 3-lead configuration here. The 3-lead configuration usually is going to show us as it moves across to the shoulder. Up here on the top part of that heart, we're looking at lead 1. As it comes across the body from the right side towards the left leg, we're looking at lead 2. And as it comes down from this side down to the left leg, we're looking at lead 3. So these would be the primary rhythms that we want the machine to show us in this most current type of EKGs that we're using. It would then signify using this one at the top lead or channel, because this is the most significant, a lot more energy going in this direction. And the rest would be things that we just want to monitor as we take a look at it. And we would not be using EKG wisely if we had these other channels empty. We want to see as many EKG tracing or complexes or rhythms, to say, as we can see. So this is just in the 3-lead configuration. Now, when you put on a 4-lead configuration, it does add more information to what we can see. In fact, it'll add more when we put on a 12-lead, and when we put a 12-lead on and we put it on a V4R, and then we continue around the back, the posterior aspect, and put on a 15-lead configuration, we get a lot more information. It's just telling us, though, electrical activity of the heart itself, and not the mechanics, just the electrical activity. If there's a problem with the electrical activity, we might construe that there is a mechanical failure and the heart's not ejecting blood, right? But for now, we know that there's a standard 3-lead configuration. And the 3 leads that we look at are being monitored 2, 3, and lead 1. These are limb leads as you place the leads on the limbs. Right arm, left leg, right leg. And they're significant. I mean, they have that abbreviation and it's named that on the lead. When you're actually placing it on a patient, it'll say RALA, RLLL for the limbs that it's going to. All right. Now, I mentioned that there was 4-lead configuration. So basically, we're placing additional lead now onto this extremity here. So we're using the right limb now, the right lower leg, as another extremity. And this changes the electrical impulses that we can see and monitor now on our screen. This gives us the ability, when we have this 4-lead configuration, to use what's called, we're using 2 different electrical impulse sites to then look at electricity. When we put on these 4 leads, we can look at energy that's towards the bottom. We can then look at energy that's looking towards the left. And we can look at energy that's going towards the right. Again, what they're saying is that we're using these several poles and augmenting and seeing what we can see here, augmenting and seeing what we can see here, augmenting these 4 and seeing what we can see here. So we're using these leads to then show us what's happening on the right, the left, and the feet. So I'll try to clean this up just a little bit. So we have the old triangle here, this Einthoven's triangle that showed you the regular lead configuration. 1, 2, 3. And when I told you now, when you put on those 4 leads, it allows us to look at energy that's going towards the feet. They're taking these leads and using all of that energy, using those electrical impulses, what we call vectors, just using that electrical impulses to determine the direction and flow of energy. So it's using the 4 leads again, and one lead, one look of this can be augmented vector F. So we're looking towards the feet. All the energy should be traveling in that direction, because we know that in leads 1, 2, and 3, In 2, it goes towards the feet, and in 3, it goes towards the feet, and 1, well, it's going across the heart, but it should really want to go towards the feet. So your additional 4 leads, the configuration, that 4 lead configuration will give us these augmented vectors. So we have an augmented vector to that side, we have one to this side, and one to this side. So basically we have an AV L and an AV R. And this gives us additional leads here. All right. So these will give us additional leads, and this will give us our 6 lead configuration. And when you place on your precordial, the cord across the heart, precordial leads to at the fourth intercostal space, right and left sternal border. You're gonna find that other one, mid-clavicular line, what intercostal, fifth intercostal space, and you're gonna find in between. So you get 1, 2, 4, 3, and then you continue to flow around with the anterior axillary line and mid-axillary line for 5 and 6. So if we add these other EKG strips up, when you put on those precordial ones, you get V1, V2, V3, V4, V5, and V6. This would give us our 12 lead EKG. And this is showing us the electrical impulses as it goes across for leads 1, 2, and 3, how it should normally travel. These ones here show us electrical impulses at a totally different trajectory. It's looking at it in a different way. But this gives us a better sense of how the electrical conduction system is conducting that impulses.